Our next group of muscles are going to be ones that cross the hip and the knee joints. They are named according to their location, whether they are anterior, medial, or posterior. Most of the anterior muscles are going to flex the femur at the hip and extend the leg at the knee. The posterior muscles are going to extend the thigh or flex the leg, and the medial muscles are going to adduct the thigh. So they bring the leg back to the midline. So all three of these groups are enclosed in what's called the fascia lata. So the movements of the thigh and the leg include flexion, extension, abduction, adduction, circumduction, as well as rotation. The thigh flexors that pass in front of the hip include a group called the iliopsoas, which is comprised of two muscles called the psoas major and the iliacus. They're the prime mover of flexion. The tensor fascia lata is going to steady the knee and trunk and tighten the IT band, which is the iliotibial band. The rectus femoris is responsible for knee flexion, and they're assisted by medial adductors and the sartorius. The thigh extensors are all prime movers of extension. So let's look a little more closely at these. For the iliopsoas group, the iliopsoas group is going to be a hip flexor. It's going to stabilize the trunk. So we have trunk stabilization, trunk flexion as well, and external rotation of the hip. Then we have the tensor fascia lata, which is often abbreviated as the TFL. It's going to steady the knee as well as the thigh by making the iliotibial tract, which is the IT band, taut. You're not responsible for the pectinea, so we're going to kind of cross that one out. The sartorius is a really long muscle, and it's a special muscle because it actually crosses at two joints, which is kind of makes it a special joint or a special muscle because it crosses at these two joints. It's going to flex as well as abduct and laterally rotate the thigh. And since it crosses at the knee joint, as you can see down here, so it crosses at the hip joint as well as the knee joint, it's also going to flex at the knee, which makes it very unique. We then see the quadriceps group. One way that I like to remember this group is Rex and his three vastus sisters, because there are, in fact, three vastus muscles. So the function of the rectus femoris, which is the main prime mover of that group, is that it is going to extend the knee as well as flex the thigh at the hip. The three vastus muscles, the three sisters that I mentioned, are ones that are going to extend and stabilize the knee. And because it's lateralis, it's located on the lateral side. The medialis is going to extend the knee. And that's also the same for the other vastus muscle, which is the vastus intermedius muscle. In order to see the vastus intermedius muscle, we would actually have to remove the more superficial vastus muscles. Now, when we look at the right side of this diagram, we can see the adductor longus, and the adductor longus is going to adduct because it's on the medial side. It's going to flex, and it's going to medially rotate the thigh. And that's the same thing for the adductor magnus. So we can kind of add this function to the adductor magnus as well. The gracilis muscle we'll be seeing on the next slide. So we'll be going over that as well. So as minor, you're not responsible for. The same with the quadratus lumborum. On our next slide, which kind of looks a little deeper at these muscles that are also crossing the hip and the knee joint, first of all, we have our entire basically adductor group, but specifically you're responsible for the adductor magnus. We can cross off the adductor brevis, as mentioned in the previous slide. They're going to adduct as well as medially rotate the thigh. The pectineus, as I've mentioned before, you're not responsible for. And the gracilis muscle, it's going to be responsible, as you could probably imagine from its location, for adduction of the thigh, as well as flexion. So it flexes and it also medially rotates the leg. So when you're learning these different muscles, it does definitely help you if you can kind of group them very similarly. So if there are several muscles that do the same, kind of group them together, make it a little easier for you to learn them. So we have the adductor longus and the adductor magnus that are shown. So these adductors, which also medially rotate the thigh, are used in movements that press the thighs together. Overstretched thigh muscles are kind of referred to as a pulled groin muscle. Looking at the anterior side, which is the large quadriceps femoris. Remember, it's named quadriceps because it has 4 origins. So that's one of the characteristics to name them. It's Rex and his 3 vastus sisters, which we've already talked about. It's a powerful knee extender, and it inserts into the quadricep tendon, which inserts into the patella via the patellar ligament into the tibial tuberosity. And the tibial tuberosity is a muscle we'll learn about coming up, which is where the tibialis anterior is located at. So just like the previous slide, remember, you're not responsible for quadratus lumborum. So as minor, pectineus, and you are responsible for the rest of them. The adductor magnus, gracilis, longus, the rectus muscles. We can't see the intermedius on this image, as well as the iliopsoas muscle.